This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
What a beautiful day to be alive. My debt is paid and more money arrives. The fridge is full and there's plenty of ice for a fireside chat with anyone I like. What a beautiful day, good to be here, when almost everyone has disappeared. When almost everyone is waiting in line, it's good to meet you in this world of mine.
Welcome, everyone, to Live with Dr. Carolyn Dean here on AchieveRadio.com. I'm Ginny Gunther, also known as Ginny Almighty, and I will be your host this evening for the next 2 hours, along with our very own Dr. Carolyn Dean, to bring you the most amazing information about health, vitality, and well-being, and how you can find natural solutions to your health concerns and or just consistently feeling better using the formulas of Dr. Carolyn Dean and her sage advice and wisdom. As we all know, Dr. Carolyn Dean is a medical doctor, having been doing the doctor thing for so many years. I think we've kind of stopped counting, although I'm sure it's in the 40s and 50s. And not only is she a medical doctor, but she is a naturopath. She's an acupuncturist, a nutritionist, a lecturer, a consultant, and an author of The Magnesium Miracle, which is a landmark work this year, the pages totaling over 600 with medical references galore to demonstrate the efficacy of magnesium and the need for it in the body to prevent disease. This evening, we're so thrilled, our very first show back, and let me bring Dr. Dean on and say, welcome, Carolyn, and then we'll explain to everybody what we're conspiring to do. So welcome to the show, Dr. Dean.
Thank you, Ginny. Thank you, kids. Great to be here. Yes, we have a landmark show for you, and I'll let Ginny describe it because she's the wordsmith of words. Go ahead, Ginny.
Well, I don't know about that, but I will say this. We're very excited because we're doing something that we've wanted to do for a while, and we are calling this series that we're going to do. We don't know how long we're going to do it, but we think we're going to be doing it for quite some time, and we're calling it the Doctor to Doctor Hour. This is our very first one that we're doing together, and we're so thrilled who we've got on for our inaugural launch of this program. But as you know, Dr. Dean comes on every week and has for years, and she's always dispensing her wisdom and stuff. And there are a lot of like-minded doctors and naturopaths and practitioners, a lot of whom she cites and a lot of whom she references their work and stuff. And she talks about them, but we thought, why not have them on and let them talk about themselves for themselves, and also to kind of give people in the audience a sense that, look, there are a lot of options that you have for your health, and we want you to know about all of them. So tonight, we are so thrilled to be launching our Doctor to Doctor segment with Dr. Stephen Hotze. And he is the founder and CEO of the Hotze Health and Wellness Center in Katy, Texas. And I know we have his customers listening to the show, his clients. He also has got Hotze Vitamins and Hotze Pharmacy. So he's very comprehensive in what he's doing. He received his medical degree from the University of Texas Medical School at Houston. And he has personal passion. Every single person that we have on has their little niche. And this particular gentleman, Dr. Hotze, his goal is to change the way women and men are treated in midlife through the use of bioidentical hormones. He's very good with the endocrine system. He's very good with the whole system of the hypothyroid. And his book, he's got a couple different books, one of which is Hypothyroidism, Health and Happiness. Another one is Hormones, Health and Happiness. And he talks a lot about his journey from using pharmaceutical drugs to actively listening to his patients and treating the root cause of their symptoms through natural approaches. And he and Carolyn have known each other for a long time. we went through the old walk down memory lane, and we're going to talk about that tonight. So we'd like to welcome him to the show, and I think this is Dr. Hotze. Is this you?
It sure is.
Excellent. Okay.
Glad to
It's
be here.
On here.
Hello.
Oh, so glad you're here.
I'm glad to be invited to Hawaii. I rarely get to go. So nice.
Yeah. Yes,
weather?
here in Maui, 80-degree weather. The sun is shining. It is beautiful here.
I got a friend of mine who's out there right now, Lee. He's been out there the last couple of weeks, and he's flying back this Sunday. So I won't mention his name over the air because he's fairly prominent. But I know he loves it over there in Maui and goes there every year and been going there for 30 or 40 years every summer. And I got to go out there, too, to Maui. We stayed at the Ritz, and I played golf at the plantation. They had a big golf tournament this week, I understand. The big on the plantation golf course, which is that mountain course. It's beautiful out there. So thank you for inviting me. At least I'm there in spirit with you guys tonight.
Right. Well, Ginny and I were going over my extensive CV, and it turns out one of the first interviews that you did with me on your radio show before you went into podcasting was in 2005.
Wow.
Now, that's a long time ago.
Well, you all sound like you're documenting everything. If you can go back and find that all the way in 2005, I don't know if it's a formal record. What we did, I remember you were on, you've been on several times. And then on the podcast, I did a radio program in Houston. Katy's really Houston, Texas. It's just a suburb. So when you think of it, we're located in Houston. I live in Houston. We're just right across the street from the city line. We're in the so-called. We're not even really formally in Katy. We're in Harris County. That's just the way it is. But anyway, we had a radio program. It was on Monday through Friday, from 12 to 1 or 1 to 2, depending on what year it was. But from 2001 up until just this last November, it was initially called Dr. Hotze's, it was called Health and Wellness radio program, Dr. Hotze's Wellness program, and then the Wellness Revolution. And it was wonderful, but what we've gone to podcasting because people don't listen to the radio as much anymore. And they've gone, you can podcast and you can pick up whatever you want to listen to. And you got to, you just don't have to flip on the radio. If you want to listen to music, put on Pandora, pick what you want to listen to. So radio's gone down. TV's gone down. This is podcasting. I'm so glad to see you doing this. It's so good.
Yeah, we do have to keep up with the times. But you know what? I'll just dive in on this because we were comparing how you've set up this huge wellness center, and I just totally downsized. I'm sitting here in my bathing suit in Maui, running my dietary supplement company. Yeah, and I just want you to tell our listeners. I mean, the incredible amount of work it must take to have the staff that you do, to see the clients. You call them guests. I mean, it's such an undertaking to.
Well, I wish you. Did I have you out here? Have you been to my center in Houston?
No, I have not. No.
Well, you have a standing invitation if you ever leave the islands.
Thank you. But yes, tell us all about it.
Let me explain to you. Now, I'm a Houstonian. Grew up in Texas. All my life went to high school here. Went UT Med School. Did a year of surgery. And when I graduated from medical school, my dad took. I was married, and I think we had 3 or 4 kids by the time I was out of med school. Anyway, Dad had a party for me, a dinner party, banquet, so to speak, after my graduation down at the Houston Club. And that night, he turned to me. My dad's a very successful entrepreneur, he's passed right now, but anyway, he was a successful entrepreneur, and he turned to me at dinner, and he said, "Son," I said, "Yes, sir." He said, "Son, don't poison your patients like all the other doctors do."
Oh, my
God. Here's
God.
my dad. My dad's not even a doctor, but he knew. Drugs are poison. They're toxins. He knew that. It didn't. I don't know how he just knew. And so that he planted that seed in my brain, which over time gave birth to the Hotze Health and Wellness Center, Hotze Vitamins, and Hotze Pharmacy. And it was an interesting path. I went into surgery for a year. I loved surgery. It was great, The old adage was the chance to cut, the chance to cure, We downplayed all the internal medicine doctors who had one lab test after another. They couldn't make decisions, running labs all day long, so they could tell if somebody died. Well, at least he died in complete electrolyte balance. You can take sorry, blood sugar was normal. Right. So I liked that, and then I went into emergency medicine. And in emergency medicine, you feel like you're doing something. People come in, you take care of the problem, and it can be anything from a snake bite to a gunshot to migraine headaches, or it can be a runny nose. You name it. I saw everything in ER medicine all over the state of Texas. Then I went into family medicine, and this was during the 1980s. And I didn't give antidepressants. I didn't believe in that. I didn't even give Valium back there. Everybody that walked through the door, every woman wanted a Valium. That was so they must have made a gobs of money off that drug. I just never did. But I treated for blood pressure and various assorted problems you see in a family medical practice with the sinus infections and asthma and skin disorders, stomach problems. So anyway, a little lady came over to my office in 1988. One morning in the spring, and she said, so I sat down with her. I'll call her Mrs. Jones. She came from a retirement center. She had a big smile on her face. Now, I saw 30, 40, 50 patients a day in this center in my clinic. It was called the Day and Night Clinic. And so I had set that up, and I saw her, and she had a smile on her face. I said, how you doing today? She said, Dr. Hotze, ever since I threw away all the medicine you're giving me, I feel like $1 million. So, of course, I thought immediately, I thought what my dad had told me immediately, don't poison your patients like all the other doctors do. I said, I said to myself, this woman's got more sense than me. All the other patients, all the other doctors I know, she knows this medicine's poison. And so then my dad came in. He was 72 years of age at this time, still ran his business. He came in and said, look, I want to talk to you. And so he comes in, I'm having some chest pain, describe it to me, Dad. So he did. And sounded like angina. So I said, let's take you over, take a look have a cardiologist evaluate you. So, of course, that's going to lead to an angiogram, or they're going to study his arteries, and found out he had a blocked LAD, left anterior descending artery. Did an angioplasty, and I was there for the procedure right outside the room with a big window watching it, and they blew open his LAD. Blew it open. He had to have emergency surgery, bypass surgery at that time. And so after that had happened, he got out of the hospital. 2 weeks later, he called me over one morning and said, son, I want to talk to you. And he wasn't in a very good mood. So I get over there, and I felt terrible, that this had happened. And so Julian Whitaker, don't you?
Sure, yeah.
Okay, so my dad, I come in there and goes, he said, I don't know what the Sam heck I was thinking, letting these doctors invade my body. Look, he said, I'm an engineer. How can you possibly, I got calcified arteries. How are you going to stretch that? How are you going to, if you put pressure on that, it's going to blow it. That's what happened. Because we're in the pipeline business. He said, in pipes, when pipes are cracked, you put pressure on them, they blow. So anyway, he said, read this. So I get Dr. Julian's Whitaker's newsletter, and I read it. It's about heart disease. And at that time, this is where the statistics. You have a heart attack and have angioplasty, you have a 15% mortality rate. 15 chances 100 you're going to die. If you have bypass surgery, chance is 5%. If you don't do anything but lose weight, exercise, take vitamins and minerals, keep your blood pressure normal, your chance of dying is 1%. He said, don't let the doctors invade your body. He said, Dad said, what do you think about this? I said, Dad, I wish we'd have tried this. I mean, I didn't know about this. And he says, well, this doctor says I need to take vitamins. What do I need to take? Well, it was dead silence. And I was like a deer in headlights. I said, Dad, what do I know about vitamins? I'm a doctor. And he looked at me. I'm the oldest of 8, 7 boys. I'm the oldest. I love my dad. He goes, son, would you find out? I said, yes, sir, I will. So that launched me. And this is oftentimes the way many physicians who take alternative approaches or natural approaches to health have chosen to go down this path because either a family member or themselves had some problem that conventional medicine just couldn't solve and just tried to palliate with drugs, and they knew there was another way when they found out. So I found out from my dad, I started learning about vitamins and learn about hormones and learn about allergies, and one thing led to another. So it took me, we set up the Hotze Health and Wellness Center in its infancy with just had 2 or 3 on staff. Now we have 100, but it was it was in its infancy. So we've grown out of that. So I started doing allergy treatment, airborne and food allergy, and I tested for that. We still do use sublingual drops. I'd used vitamins because I studied about that. When I went to all my Pan American allergy study conferences and various conferences, always vitamin people around, so I learned a lot from that. Read a lot of books, and I learned about vitamins.
I think that's my memory as well of where it all kind of started. On the medical side of things, they were looking at allergies, and there was one clinic that did it. But what year did you start out? What was that? 1988 when you?
No, we opened the office in '89. We opened it in July 6th or 7th in '89, July 9th. And the first day I opened up out here. Now I had another office that I ran, so I'd split time, half day there, and try to get the other office opened here, out on the west side of town. But the long and the short, what this did is it led me down a path where I did airborne and food allergies, I did vitamins, and I treated for yeast, because all these patients that have allergies have been on loads of antibiotics, and they kill off the normal healthy bacteria and get the yeast overgrowth, causes a host of problems. So they get that. Yeah. And then a physician friend of mine who was an allergist and an OB-GYN doctor told me in 1992 at a conference, he goes, "Steve, you got a lot of female patients who have thyroid problems." I said, "I do." "Yeah, you do. A lot of them have autoimmune thyroiditis." I said, "Really? What do you do for it?" "Well, you give them Armour Thyroid." So I went to the head of the society. His name was Dr. Dorr Brown. And Dorr Brown he's an old codger. He was a good one too. And he was 84, and he just was plain spoken from Fredericksburg, Texas. And people came from all over the world to Fredericksburg, Texas, because he was so good at allergy and hormone treatment. So anyway, I said, "Dr. Brown, Dr. Mabry says I've got women in my practice who've got thyroid problems." He said, "You do?" I said, "Well, what should I treat them with? Should I use the synthetic or what?" He goes, "Use Armour Thyroid." I said, "Why?" He said, "Because it works." Okay. So I did. And I came back and started testing. And sure enough, 30% of the females that came to my office and 18% of the males have autoimmune thyroiditis. We pick it up in the blood. They've never been checked on that by their regular doctor. And then I read Broda Barnes's book, and then I started to treat thyroid based upon clinical symptoms and not on blood tests, because the blood tests you cannot treat a patient for thyroid or hormone problems based on blood tests. You have to know what the symptoms are. We've been using, it was in the 1980s, I think 86 or 85 is when they first recognized hypothyroidism is a disorder. It was called myxedema, and that was a Clinical Society of London. When they had their meetings, they had been studying this, and they made the diagnosis of that this was myxedema. And all the patients that they studied back then sound like all the patients I see in my office every day. Yeah. Same symptoms, except if left untreated, they end up dying of a host of problems. So I treated for thyroid, and then you're probably familiar with Dr. John Lee, too, aren't you?
Sure. Yeah.
Dr. Lee wrote the book on progesterone. Well, in 96, walk into a room, and a young lady in the room says, "Would you like to listen to this tape by Dr. John Lee about progesterone?" And I went, "Gee, man, I just read about it last night. I just got a monograph from Dr. Whitaker and I said, "Yeah, and read all about natural hormones." I said, "Sure." And I listened to it. It sold me in 30 minutes on the way home. I said, "I've got to use this." So I called Dr. John Lee the next day, found out where I could get this stuff, which is compounding pharmacy, which I didn't know anything about. So we started that and gave that, and we had unbelievable response on that. It was crazy how well the women did it when they got on the progesterone and balanced out their hormones. And then we started using cortisol, safe uses of cortisol by Dr. William, I can't remember his, McHenry.
Oh, right. Safe use of cortisol. Yeah.
Yeah, safe
I know
uses
who
of
you're
cortisol.
talking about.
And then we got our eating program right with paleo eating program and exercise, and so we built this. I've slowly over time. Here's what I do: if a guest or patient of ours has a problem that doesn't get solved by what we're doing, I ask what else could be going on. I mean, normally, when you see it work in 80% of your patients, you have some people that really struggle. Something else is going on. What is it? So that's how I added to, when people had allergies, they still had other problems besides their allergies. And finally I learned how to address them with hormones or with treatment for yeast or with vitamins and then, thyroid. And one thing led to another. And so we built a regimen where we treat here for airborne and food allergies. And we use sublingual drops to immunize as opposed to injections. We treat for yeast.
Well, you know that the yeast overgrowth is going to set people up for allergies. I think you've come to the place, as I did, that all these things are so interrelated that if you put people on a good diet, give them the right building blocks, and let their body kind of take on as much as it can. But
the body will heal itself. If you put the right minerals in the body, your body, and that goes for food and vitamins and minerals and replenishment of hormones, which is so critical. It's critical.
You've been so good with us because if you go to Dr. Hotze's websites, he praises Remag as being the best magnesium that he's ever used. But I don't know if I've sat down with you, Dr. Hotze, to tell you that with thyroid, what I discovered after I did the Remag, I made a multiple mineral called Remite. And 9 of the 12 minerals in Remite support thyroid function. So we're actually seeing people who get off their Armour or their synthetic as their thyroid heals, and that's been quite a revelation.
Well, that's good, and I'm always interested in learning from you if that can be done. We do know, though, that we have a host of people that have autoimmune thyroiditis, so they're making antibodies to their thyroid gland, and that's causing a host of problems. And now you can try to overcome. We try to bring down that level. Find out. First thing you do is clean out the gut because it could be related to foods. You got a leaky gut syndrome. You know the whole nine. It could be related to that. But back on thyroid, one thing I want to stress: the reason that we have such a problem with thyroid in America is because we have fluoride in our water. And fluoride poisons the deiodinase enzyme within the cell that converts the active thyroid hormone or the inactive thyroid hormone, which is T4. That's the thyroid molecule with 4 iodine atoms attached to it. The enzyme in the cell converts it to T3. That's the thyroid molecule with 3 iodine atoms attached to it. And that's the active thyroid hormone that activates the mitochondria. And that enzyme, the iodinase enzyme in the cell, is poisoned by fluoride. And in America, you want to, why is everybody so fat here? Overweight? What's going on? Well, when in the 1960s, the overweight percentage of the population was 16%. Currently, it's 70%. Obesity was 8% of the population. Currently, it's 35% of the population. Why? Why? Well, it's the foods. We go to there's no question about it. The foods will contribute to that. But we go to Europe, and they eat bread, and they eat pizza and pasta and a host of other stuff, and their overweight population is 16%, just like ours was in the 60s. And their obese rate is 8%. If you ever go to Europe, walk around, the people, well, why? Well, they walk around. Well, is that right? Why are they so thin there and so fat here? Well, one correlation you can take is that if we were the same as they were then, what did we do different? We put fluoride in the water. And fluoride poisons. It also poisons the enzyme that allows the iodine to attach to the thyroid molecule. You know, it's a halogen. Fluoride's a halogen. So you've got bromine, chlorine, fluoride, and what's the other? There's one other: chlorine, bromide, fluoride, and another one there. And iodine. Well, it's iodine. So iodine is one of the halogens, and these compete with one another. And so you take fluoride, it's going to compete with the iodine.
Yeah, but listen to this. That's why saturating with the Remag is so important, because it will take out the fluoride to a certain extent.
Right, and that's magnesium will do that, and that's very, very important. Problem is our people get so overweight, you know where it goes? It goes into the fat, and it leaches out. They store it. I've read this where 50% of the fluoride that's intaken gets stored in the body. So you can imagine you build up this toxic load over a lifetime. So the point of that being is drink clean water, folks. That's what you need to take. Your magnesium. That's important. You get multivitamins. Magnesium is key, as Dr. Dean has written so wonderfully about, and we're strong advocates of magnesium.
Oh, yeah.
Push that magnesium. Yeah. It's awesome. And we sell Remag down here in our vitamin store as well. But the key thing is get clean water. Get a filter system at your sink. I filter our water coming into the house, and then at the sink I have a reverse osmosis. But you can buy something less expensive that you can make sure the water you drink, folks, is clean. It doesn't have any petrochemicals in it. It doesn't have any fluorides in it. Those petrochemicals, when you think, oh, I'm doing good, I'm drinking wholesome water. I bought it at the store. It's in a plastic bottle. Well, just go ahead and poison yourself. That's got all kinds of polyphenols in it and plasticizers, and all that stuff gets in your system and poisons you. Those are hormone disruptors. They act like xenoestrogen. They're xenoestrogens, so they have the effect of estrogenic effect on the body, and they get into the receptor sites in the cells for female or male hormone. They clog them up, and the body doesn't know what's happening. And then it poisons the mitochondria, which is your power plant within your cell. So you want to drink clean water, folks. That's if you come away.
And that's a good simple advice. That's where we start. Drink enough water, and also I don't know if you're doing this, but we tell people to get a good unrefined sea salt and put it in their drinking water, because especially if you're using RO, reverse osmosis water, you're taking everything out. A lot of the filtration is removing our minerals, and that's where we have all this mineral deficiency problem.
Well, this is true, and that's why if I recommend it, I used to drink Mountain Valley water. It's the only water I know. There may be some other company that does it, but Mountain Valley has it in glass, and it comes out of a spring in the Ozarks, and that's great water. And I don't know of anybody else that sells water in glass. Everything else comes in plastic, as far as I know. But Mountain Valley's great, and I've promoted them for years, and used to use it.
Well, we're at the bottom of the hour, Dr. Hotze. We have questions that have been flowing in, so I don't want the questions to go unanswered. So I'm going to turn it over to Ginny to start asking questions of you and me periodically. Go ahead, Ginny.
Okay, let me just let our callers know, too, because we have live callers on the phone who have questions, that we do want to honor your questions as well. So 602-666-6027 is the number to call. And if you have a particular question for Dr. Hotze, please hit *5 on your keypad. I see a lot of callers on the phone, and that will raise your hand in the studio and let me know you do have a question, and I will put you on the line with him. Also, please note that he's only going to be on for a half hour still, so don't wait until the last minute and then everybody clamor in on the phone. Let's try to get you in early. So I do have a caller from Irvine, California that I'm going to go to in just a minute, but let me also, doctors, take these questions and I'll let you both respond. The first one came in, what do you recommend for hyperthyroidism and nodules? Thank you very much.
Okay. Hyperthyroidism is a state where a person's thyroid gland is producing or leaking too much thyroid hormone into the bloodstream, and it causes a hyperactivity, too much energy production. So what happens is the heart races, you sweat, can't keep any weight on, it overstimulates your body. And it's primarily caused by an autoimmune thyroiditis, but it's called Graves' disease. Why Graves' disease? Because Dr. Graves described it, and it's a Graves' disease. And they will also get exophthalmos, their eyes will bulge out, they get the bulgy eyes. So, it's many, it's the thousands of people we have seen at our center. I could count on my hand the number of people that have come in with hyperthyroidism, which is strange. But we don't see it much. And what I wouldn't do is do radioactive ablation on it. There's some anti-thyroid medications that will interfere with the production of thyroid hormone, like propylthiouracil and some others, that can be. I'd always use those before I do radioactive ablation, because sometimes the gland will settle down. And if you have radioactive ablation, you wipe out your thyroid gland. You end up going to be seeing a conventional doctor who's going to put you on synthetic thyroid, and you're going to be a mess for the rest of your life. Mm-hmm. And if you're not, if you think you've got nodules, just have them checked and see if they look benign or not. You just get an ultrasound of the thyroid gland and look at that.
Yeah, there are so many things that Dr. Hotze would be doing and I would be doing that would actually support the thyroid going back into balance, whether it's hyper or hypo, going off gluten, going on a yeast detox. There are many things that a person can do. I did a little booklet, Dr. Hotze, on resetting your thyroid, and I have a few things in there that can be helpful. But I think what you and I find all the time is that when you cover the waterfront, you take care of a lot of issues. I think the people coming to your clinic, people coming to my website for my products, they've probably gone off their gluten and gone off their sugar, done a few things that's already starting to help them. But it is the people. For example, we've got one question from someone, Ginny, I think it's there, about being on the iodine drug for atrial fibrillation, Amodorol, or am I saying that right? Do you know the one I mean, Dr. Hotze? Ginny, do you have it there?
Yeah, I can read it. It says, I'm wondering if amiodarone-induced hypothyroidism reduces itself. I was on it for 9 months from 2013 to 2014. And then she says, I tried to be MIPE but began having more frequent AFib episodes, so I stopped taking it, but I am still using the Remag plus the Remag lotion. Any information would be appreciated.
What was she taking? Amiodarone? What was she taking?
Yeah.
Amiodarone, Amiodarone. That's that AFib drug, and it's got two molecules of iodine in it. Yeah.
I'm telling you what I'd say stay away from any antiarrhythmic and get yourself on magnesium. Most people that have problems with irregular heartbeats are low in magnesium. And, of course, they can have ischemic heart disease. So they got a poor blood flow to the heart, and that can stimulate that as well. But magnesium is something everybody ought to be on that from the get-go early on, because most people in America don't even take the required daily allowance, which is minuscule compared to what we need, and don't even get that in their diet. So magnesium is important. Now, this person has got, I'm telling you, these antiarrhythmic drugs, I've been around now for 40 years in medicine. They're dangerous. One of the side effects is it kills you with an arrhythmia. I mean, it's crazy.
Yeah.
I see those drugs. I trust the drug companies about as far as I could throw them. I guarantee you that. They're in it for one thing, and that's to make a profit. And I don't have any. I'm a free enterprise guy. I want to make a profit. I want to make more money than I spend in my business. I want my income to be bigger than my expenses. That's called a profit. You got to make it to stay in business. Well, but I'm trying to offer a service that's good and healthy. When you know you're poisoning people, and these drugs, they've taken, I don't know how many antiarrhythmics in my career I've seen come off the market. They were the next.
Yeah.
It was the panacea of all. And then a year or 2 later,
they have to take them off because they've killed so many people. But
the
flecainide drug.
Flecainide.
Dr. Hotze, it's got 6 fluoride molecules.
Yeah.
And even though they may say to you about the flecainide or the doxycycline, which is a fluoride antibiotic, Prozac has fluoride, they'll say, in the test tube, the fluoride doesn't break down. But what we know now from all the gut flora research is these trillions of bacteria in the gut, they break down these drugs and they release the iodine or the fluoride or whatever else they've put in it.
So back to this lady's problem is, what a person can do. Atrial fib can be a problem to treat. It's, first you want to try to get at the root cause of the problem. And I've had some patients that have had ablation, and I'm not a big fan of the idea of that, but they've got some benefits. I've had some people that had bad atrial fib that it affected them. But my dad lived he had atrial fib from the time he was 22 until he died.
Oh,
he had atrial fib and lived a long life. And so I see some people with it, and they tolerate it. They seem to tolerate it well.
Right. Well, I saw a few years ago? They just started getting on to AFib and testing everyone, doing the EKG.
Oh, sure, they do that so they can sell them these anti.
The anticoagulants. When they came up with the new blood thinners, they said, well, we have to put these to work. So then they scare everybody that if you have any sort of arrhythmia, you've got to be on a handful of drugs. And then, the FDA, they'll tell me, well, I'm not allowed to say to people that you could be having a magnesium deficiency AFib, when that is very often the case. So we have to tread lightly in what we tell people, because the drug companies do think that they have the only cure, and they won't let dietary supplements be looked upon as being any better than drugs. It's really quite frightening.
Let me ask you, from my point of view, I'm interested in your answer in this. If a person was going to take 5 vitamins and mineral supplements, could you limit it to 5? What 5 would those be?
Well, that's easy, because that's what I've worked it down to. They take my Remag, my Remite, multiple minerals. I have something called Realign, which is methylated Bs, and taurine and methionine. Methionine, glutathione precursor. And I have a protein powder, Restructure, which is a whey protein, and it's got a lot of nutrients in it. And part of the Restructure is something called RNA drops. We powder our RNA drops, and that's a barley extract that has all kinds of very exciting benefits for our people, and I just stick with that. Well, then I will tell people about soil-based probiotic. We like people to take that.
What about vitamin C?
Well, with the C, I do say food-based vitamin C, the probiotic food-based vitamin C, and a fermented cod liver oil, blue ice royal. So it's actually 8 things that I'm recommending.
What about vitamin D, D3?
That's in the blue ice royal, Dr. Hotze. It's the blue ice royal, fermented cod liver oil, and butter oil has A, D, and K2.
One thing I'd recommend to anyone that when you see a physician, make sure they check your vitamin D level. We see thousands of guests here at our center, and I'm telling you, when they come in the first time, they're in the gutter. and we live in Texas, and they're just in the gutter, the D level, and we push vitamin D. I personally take 15 to 20,000 units every day. And recently I got a book by somebody who had written a book on, he had taken large doses of vitamin D and had tracked his health over 2 or 3 years, and it was really pretty phenomenal. I don't recommend necessarily overdosing, but I do know it's very helpful.
Here's my input. Yeah, it's very important, and you're probably just fine with it, but I have the experience, as soon as the high-dose vitamin D started coming out, I had a lot of people getting back to me saying, as soon as I started taking this, especially the 50,000 synthetic, that's just way too high, they said all my magnesium deficiency symptoms are back. And when you look at the metabolism of the inactive vitamin D to the active vitamin D, it pulls in a lot of magnesium to create the active vitamin D. So the more vitamin D you take, the more magnesium you divert from its 800 different enzyme processes. I've had people with 6-week migraines, their angina comes back, all the magnesium deficiency symptoms.
From taking too much vitamin D?
Without magnesium.
Right. Well, I always push magnesium, minimally, if they're using the Remax or magnesium glycinate or whether they have mag citrate, we have 3 different products, and we push that. I take myself, besides the Remax, I think I take 1,000 milligrams a day of magnesium.
Yeah.
Glycinate.
Most people, they do need enough to saturate. You see, we have to saturate the body without getting the laxative effect. And see, what I find is we get our reports from our customers, and they'll go off the high-dose vitamin D, take the Blue Ice Royal, take their Remag, and their vitamin D levels go up. But, the whole thing about vitamin D being a hormone and the one they test for is the inactive vitamin D, they really don't have a good test for what's actually going on with the body. And it makes me wonder, I don't know if you ever came across Dr. Mildred Zelig. She wrote the book, The Magnesium Factor. She told me in a phone conversation once, when she worked out of med school in a pharmaceutical company, they had her test the vitamin and mineral levels before and after they gave their subjects drugs. And she said invariably the magnesium levels would become elevated after people took their drugs, but then after about 6 or 8 weeks of the drug trial, the magnesium levels would be rock bottom. Now, what she determined was that these drugs and maybe high-dose vitamin D stimulate the release of magnesium from storage to try to deal with the problem. And even the beneficial effects of drugs and maybe even vitamin D in the beginning can be because the magnesium is stirred up. But I don't know who's going to do those studies, but that's really important information.
That's really important information. I appreciate you bringing that to the audience and my attention. That's very, very good, because I decided to bump up my vitamin D, but I take a pot full of magnesium, and all that. I take more vitamins than Carter's got pills, and he had a lot of pills, if you remember, back in the old days.
Oh, I know. And I used to do that, but seriously, Dr. Hotze, I'm just taking a tiny handful of things now. Like I said, those 8 things, and the way we've got it worked out with our...
Well, here's what I do. I'm a strong advocate of vitamin C. I'm a Linus Pauling devotee from way back. I've used it. And I've taken 10,000 a day for at least 25 years. Now I take at least 15,000 every day. My arteries are as clean as a whistle. I am convinced that the reason we have coronary artery disease in the country is because we are deficient in vitamin C. The RDA is you got to have at least 2,000 milligrams a day of vitamin C to show any benefit to the coronary arteries. And now you go to the PubMed, there are tens of thousands, 50 or 60,000 articles in review medical journals dating back 50 years even of all these studies on vitamin C. It's cheap, it's inexpensive. It is what enables your body to make collagen. You've got to have lysine, proline, and you've got to have vitamin C to make collagen, which is what heals your arteries when they get inflamed. It's not the cholesterol that causes the heart disease, it's the inflammation. The cholesterol is just a patch, a Band-Aid that the body uses as a backup mechanism if it doesn't have enough vitamin C in that area to produce enough collagen. So I tell all my people, I want you to take the average mammal. Every mammal, by the way, makes vitamin C. And every mammal except human beings, monkeys, guinea pigs. Why God left this out, I have no idea. We miss an enzyme that converts glucose to vitamin C, like any other animal. If you got a skeleton, any animal with a skeleton, including fish, they make their own vitamin C. And goats make about 13,000. Adult goats make about 13,000 milligrams a day. If they get under stress and pressure, they make 100,000 milligrams a day. So I follow Dr. Levy's work. I've recently read some of his work, but you probably know Stephen Levy, I guess. And he's So
you know what Dr. Levy recently said to me. I was involved with a conference. He said he's beginning to wonder if magnesium is even more important than the high dose vitamin C. So everything you say about vitamin C, you can say about magnesium, but why not do some of both is what I would always say.
You've got to do them both. I'm a strong advocate because magnesium will lower people's blood pressure. This is one way when people come in here and they're on blood pressure medication, first thing I do is say, well, I went to the doctor to check my blood pressure and said it was elevated and put me on this drug. Okay. Did you check it at home? Did you go home and no? Why do you know you had high blood? Well, one time doesn't mean you have high blood pressure. You got to get a cuff, go home, you check it morning and night, see what your blood pressure is. First thing we're going to do, we're going to put you on a good healthy eating program. We're going to exercise. That means you're going to walk. We're going to put you on high dose magnesium, and I'm going to get them on some other vitamins as well. And we'll check you again, and we'll check in a month and see how you're doing. Don't let a doctor, folks, remember, high blood pressure is not a diagnosis. It's a symptom of an underlying problem. The problem is the diagnosis. The symptom, what most doctors do in America and probably across the world, anybody who's trained in America is trained this way. They take your symptom and they convert it to a diagnosis and change the name a little bit, maybe put a Latin spin on it. So you got joint muscle aches and pains. They spend $1 million or $100,000 workup, give you X-rays, blood tests, and everything. Well, we've decided you have fibromyalgia. What in the world's fibromyalgia? Well, it's joint muscle aches and pains. Oh, well, that's what I told you I had. Yeah, but I told you it in Latin, so it's a diagnosis. Well, that's not a diagnosis. It's a symptom. So I say most doctors in America are afflicted with a disorder called labelitis. They want to label everything, chronic fatigue syndrome. Why? The question should you've got gastritis. Why? What's causing it? You have an arrhythmia. Why? What's causing? There's an underlying cause of the problem. And I think in most cases, and I'm overweight. Why? Well, you need to exercise more and eat less, and people get that way when they get old. Well, this is the key thing. First, for anybody out there in the listening audience, don't take your doctor as make him out to be a god. Don't hesitate to ask him questions. Why? Why do I have this? What do you recommend? What are the side effects if I take that? Ask a bunch of questions. Be informed. If you ask a doctor why and he gets mad at you, fire him. You don't want to be around somebody. You're an educated individual. You're listening to Dr. Carolyn Dean, for crying out loud, and we know you're bright, so you can be educated. And frankly, for the most part, I'd stay as far away from a doctor as I possibly could, unless I have an acute injury, a laceration, a broken arm, or something like that. But you want to be very careful because they're going to find a labeled to put on your symptom, and then they're going to give you a drug to treat your symptom. And drugs are nothing but toxins. They have to be detoxified by the liver, and a toxin is a poison. So he's going to give you a poison to get rid of your problem. Help me. That doesn't make any sense. You don't even need to do double-blind studies to know that doesn't make sense. It can't work. It cannot work.
Okay, let me just say this. We've answered one question. We've got 8 minutes left. Ginny, do you have another question that you could ask Dr. Hotze?
Well, I do. I do have lots of questions and also callers. Let me put somebody on. The main thing is, let's just clean up a couple things. There's a couple themes here. One of which, let's clean up the vitamin C controversy. Is it what form of vitamin C is the best? We've got whole food vitamin C. Can you just take a vitamin C from the store? Where is the vitamin C coming from, and what is the recommendation?
Okay, Carolyn, what do you use in your vitamin C product?
Well, we have natural vitamin C in our Restructure, but I recommend it outside food-based vitamin C complex. But with adrenal gland support, I do tell people to go to the ascorbic acid 1 to 2 grams a day. So that's sort of the extent of my vitamin C recommendation.
Well, there's a lot of different ways to skin a cat. And the way I skin the cat is I use high doses of vitamin C, and we use a slow-release form. Is it the ascorbic acid or the synthetic? It's made in our vitamin. We have it made, and I tell them to get the highest quality, so I don't know the answer to that. But I've been taking it for 25. I've been taking my product for 25 years, and my arteries are clean. Everybody over the age of 50 ought to have a heart scan. And you ought to find out if you got any calcification of your arteries. If you do, it can be reversed. But you got to reverse it with vitamin C, high doses of vitamin C, proline, lysine, magnesium, K2, and a host of other products that will help. And you got to clean up your eating program. But we've seen it here. I've got a CAT scan, and we have everybody usually over the age of 40. But by the time they're 50, we get that. And we can, my wife, for instance, I'm surprise, she's 68. She has a heart scan. She's got a score of about 360 or 380 on it. And it kind of made me worried. And so we took her over and we got a heart. I got the test for the heart, the stress test.
Angiogram.
Yeah, no, it wasn't an angiogram. It was a stress test with the thallium stress. So we did that. Half her heart wasn't getting any blood to it. And she looks as healthy as she could be. I'm going, oh, my goodness. She could just die on me like that. And so it's the only non-invasive heart test you can do to see if you got coronary artery disease. If you've got it, this is what I find. When people find out they have calcium in their arteries, they get serious about cleaning up their diet, and taking their vitamins and following the directions. If you don't, you go, I don't know, I feel pretty good. Well, people, remember, only half the people survive their first heart attack. That's a big number. Right. Only half the people that have heart attacks survive. So
we have reports from, you've got your clinical and you're doing all the testing. We depend on our customers to give us their before and after. So we're having a lot of people who have their scans, and then they tell us their carotid artery calcification is down by 30-40%, and their ejection fraction is improving. And I'm using high dose magnesium and the little bit of vitamin C. So just like you say, there's many ways to skin a cat.
Well, that's interesting. It's interesting to. I'll have to think more because I'm a strong advocate of magnesium, and I know how important it is. But how would it, if you need vitamin C to make collagen?
It dissolves the calcium, so it stops the calcium from precipitating in soft tissue. Right. So perhaps it's just stopping that irritation of the lining of the arteries that starts the first injury, that then the cholesterol has to fix. But the vitamin C, if you're having some fruit, if I'm telling people to take 400 milligrams of vitamin C complex, that's the 8 different chemicals in vitamin C, not just the ascorbic acid. So, I've always wondered, well, ascorbic acid is just one of the 8 chemicals in vitamin C. So what's it doing? It's almost like a medicinal treatment using the vitamin C rather than just a therapeutic healing of the body or making the collagen. It's always been a question for me too, because I certainly grew up learning about Linus Pauling, but I guess when I got into more whole foods, I just queried the whole ascorbic acid business.
Right, and which is good, and I appreciate you bringing it up. I've just been an advocate of it, so I'll look at that. And I've read Dr. Levy, and it's antiviral properties, antibacterial. I had a friend of mine whose wife was in the hospital and was septic, and she had been sick in a long time in ICU. And I went in and finally said to him, I said, "Look, she is without a doubt she has got scurvy. You got to get her vitamin C." And so I said, "You got to get her on vitamin C." Well, she had 4 different bacteria growing in her blood. She was on her way out. The doctor told him to pull the plug. I said, get her vitamin C. He fought with them and fought with them. They didn't want to do it. Finally, they give her IV vitamin C. I was leaving town. That was on a Thursday. I thought she'd be dead on Friday or Saturday. I come back. She's sitting up her bed on Monday. Doing well. Awesome. I mean, and then it turns out there was a doctor in Virginia who began to give high doses of vitamin C to these patients with sepsis in the ICU, and they began to have remarkable.
I've read about him. Yes, and it's so accessible for doctors to do that.
Well, and it's inexpensive, but they don't have it on the regimen. So anyway, there's some. So there's got to be there's some significant benefit, whether it's ascorbic acid, the vitamin C, and when you're talking about 8 different forms of 8 different vitamin C is a molecule. Vitamin C is vitamin C. What do you mean 8 different chemicals in vitamin C?
In vitamin C complex. The analogy I was given years ago was that it's like ribose. The juice is ascorbic acid, and when what is his name? The professor that discovered it, Sangori or whatever, he said that it's not just ascorbic acid. You've got all the bioflavonoids. You've got what's in the rind. What's in the pulp that makes the vitamin C complex.
Right. That's
well, you guys, listen, this is such an amazing and robust conversation. I hate to break it up, but we are way past the top of the hour. We've preempted our commercial break, and Dr. Hotze, I just want to share with you, our chat line is just buzzing with people who've been so inspired by your presentation. They're like, Dr. Hotze's great. He's open. He's ready for more. He's excited. He's passionate. We love him. So thank you so much for joining us. It's just
it was great. It's always a great to be with Carolyn and Dr. Dean, and it's great to be with you, Jenny. Thank you so much, and appreciate you guys giving me the opportunity to visit with you. As always, I learned something, and I'm amazed by what a wonderful work you do, Dr. Dean, and I thank you for advancing the wellness revolution.
Thank you.
Well, listen, we've got your information. We're going to forward it on to all of our listeners. Anyone feel free to contact Dr. Hotze if you feel you need to replay this. Go ahead.
I was going to say, if anybody is interested, I have several books. I have my Opus book is Hormones, Health, and Happiness. If anybody's interested in that book, I'll be glad to give it to them free and ship it to them. I think we'll just charge shipping charges on it. We'll give you a free book. You can call our number, 281-698-8698, 281-698-8698. Or they can go to our website, HotzeHWC.com. That's HOTZ as in zebra, E as in elephant, H as in health, W as in wealth, C as in cat. So HotzeHWC.com is the website. But I'll be glad if you just tell them you heard me on Dr. Dean's show, and we'll send you a book. And I also have another one called Dual 180, and I have another book, Hormone, Hypothyroidism, Health and Happiness. So they can go to the website and see those. But anyway, if they like that, I'd be glad to send those to them.
That is so wonderful. And
sweet.
so thank you. That's so sweet. Yeah. Thank you so much for joining us. It was
God bless you. And with God's help, make it a terrific 2018.
Absolutely. Thank you.
See y'all.
All right, you guys, listen.
See y'all. Thank you,
Dr. Hotze. Thank you. You guys, listen, we're going to take a quick station break, and then we're going to be right back with Dr. Dean for another hour. We'll clean up some of these questions and press on with phone callers and continue the show. Thanks, everybody. We'll be right back.
We'll be back with Hour 2 of Live with Dr. Carolyn Dean, along with host Ginny Gunther, after this brief station break. You can also get updates and resources online by visiting drcarolyndean.com.
Psychic radio, holistic radio, spiritual radio. This is achieveradio.com. Follow us on Twitter at twitter.com/achieveradio.
Beautiful day to be alive. My debt is paid and more money arrives. The fridge is full and there's plenty of ice for a fireside chat with anyone I like. What a beautiful day, good to be here, when almost everyone has disappeared. When almost everyone is waiting in line, it's good to meet you in this world of mine.
All right, everybody, welcome back. A little less than an hour left in our show, 53 minutes, I think, but that was so much fun to go over the top of the hour with Dr. Hotze in the last hour. Welcome back. You're live with Dr. Carolyn Dean. Carolyn, that was fun.
I don't know. Did we confuse people? Because I guess, well, Dr. Hotze is wonderful. When he learned about REMAG, he was on the phone with me talking about it and all the rest of it. And now I told him about REMITE, so that's going to be fun to see if he incorporates that. There's, like he said, there's so many ways to skin a cat, and I guess to forestall questions about should I be taking 10,000 grams of vitamin C a day? I went through all that. I tried it out. It does, at high doses, vitamin C causes a laxative effect. So, I thought, well, it's a bit irritating to the intestines. How good is that? And I guess I, for my own health reasons, settled on magnesium and then was able to settle on REMAG and realized that it saturating the body with the Remag helps so many processes. It's doing things for vitamin C as well, and making the vitamins that you do take work really efficiently. So we have different, thank goodness, natural ways of coming to the same end. I would just say that mine just means you have to swallow less pills, basically.
Right. Well, what I liked about him was, first of all, he does include magnesium. And a lot of these doctors don't. I mean, these naturopaths and stuff where people come in, to our situation, and they've been, not only that, I mean, they've been told by their doctor not to take it because it's just a laxative. The level of ignorance about about magnesium is not, even present in Dr. Hotze's world. So I think it's fun to hear him, say, hey, high dose vitamin C. I didn't know it was an calcium artery blocker thingy. I mean, I don't have any concern about that in my life because I do take so much Remag. And I think, it was great to hear his him, echo so many things that you say. Like, stay away from doctors. Right. All they've got is poison. And, pay attention to your diet, exercise, and get on some good fundamentals. And the other thing I thought that was great was he was asking you, hey, now explain to me about this magnesium. How could that be happening? And even though he's got it there, he's got to take it up to the next level. But that piece of education, we know, I mean, is your labor of love, and that's true of so many. And boy, we're going to be doing a great job educating this year, Carolyn. We got a lot of tricks up our sleeves, don't we?
Yes. Oh, definitely. And it's a bit of a uphill battle for some, not for us. We're on the straight and narrow. But for example, someone sent me this kind of internet scare about magnesium. One of the emails sent to me this past couple of weeks. Thank you for your wonderful information. I'm trying my best to control my atrial fibrillation and reading everything I can get my hands on. Now, that may not be a good idea because she said, I just read an article today that has me worried. Here it is from the National Institute of Health. They say, high intake of magnesium from dietary supplements and medications can cause diarrhea, nausea, abdominal cramping, and extremely high intake of magnesium can lead to irregular heartbeat and cardiac arrest. So there's somebody who's trying to get information from the internet, and they even say from dietary supplements and medications, because you see, with the bowel prep used for colonoscopies, they will give someone a magnesium citrate of like 50,000 grams of magnesium citrate.
Really?
50,000. And yeah, we're talking about taking 1,000 milligrams, which is 1 gram. So let me look up mag citrate bowel prep. I thought I did that earlier. So it's a horrendous amount of magnesium, and I think that periodically someone might just react, and then they blame it on the magnesium, and then they act like any bit of magnesium you take can cause you to have a heart attack. And this is what this woman is writing us about. She said, I understood from reading all of Dr. Dean's information that you could not get too much magnesium, but this indicates it can cause irregular heartbeat, which is what I thought atrial fibrillation is. I've been increasing my magnesium to try and get rid of this chest pain, but now I'm worried I may be taking too much. So she goes on some more about how no one will give her a straight answer about her chest pain and what should she do. So this is our task in life, me and Ginny in customer service, to try to educate people that slowly taking your Remag and slowly building it up in your body is going to be beneficial for you. And some other emails and customer service situations that arose. I think just recently I noticed that a couple of people, they'll start their Remag and they'll take it for a couple of weeks, and they'll start to maybe feel some detoxification from it because it starts making everything work better. They might get a bit of yeast die-off as the magnesium is supporting the immune system to get rid of yeast. So they feel something. They feel different. And it scares them. I mean, people are just walking, with their nerves on the surface, just frayed nerves. A shift happens, and even though I try to talk about when magnesium makes me worse and something is going to shift, people will say, well, this is hurting me, and they will stop. And then a day may go by, and then they feel even worse because they're now in magnesium withdrawal. Their body's gotten used to that little bit of magnesium. They were feeling better. The body started to work more efficiently. It started to dump stuff, and they interpret it as a bad thing. They stop the Remag, and then they feel worse. And one lady was very extreme about how she described, I'm afraid I can't get off Remag, as if she was addicted to it. But she was in withdrawal, and, we sorted things out with her. But this is the dilemma that we're in, trying to explain to people who've never had a doctor talk to them about nutrients and never realized how they could, sort of monitor their own health to try to get better, to try to understand what's going on in the body. So anyway, that was a little detour there in the middle of it all, Ginny, but I thought it was an important time to put it in. Okay, back to you, Ginny.
Yes, no, I agree. I mean, it is, I had somebody on the phone with me tonight, and, she was freaking out because she was feeling a sensation in her legs, like she wasn't even aware she had them. And I'm like, that's because you're alive. You're becoming aware of your body. The electricity is firing. Your electrolytes are working. Your brain is working. Ion always talks about people just being already dead and waiting for a disease to claim the body. And I think a lot of people who have been highly medicated, they've been sick for a long time, they've been on a crummy diet, and then they do have some kind of a health concern. It gets their attention, and then they dive in, and they are anxious to try to resolve the contrast. They don't know how to navigate through contrast, and they just want to pile it on, and then they do start taking the products. They start to feel better, and then these sensations, like this one lady says, I feel my heartbeat now. And I'm like, and I said, and what you do when that happens is you say, thank you, heart. Glad you're here. Glad I know you're here. You just acknowledge your body is alive. It's a vibrant, system. And people are so disconnected and detached from themselves. I don't even think they really feel their bodies. So it is a lot to take on and work with people about, but I'm just so glad that our products do induce that level of aliveness. I mean, it's just incredible.
Right. So yes, it's well said. As your body is waking up, you have to greet it rather than be freaked out by it. And I think it's what's happened in our society. If you have any symptom, if you have a headache, take a pill. I mean, it's just so common for people to suppress any symptom and to do it so unconsciously that they don't even realize they're doing it. It's really quite incredible.
Yeah, it is. It's really something. Well, listen, we've got people who do have questions that we weren't able to get to in the first hour, Carolyn. So I'd like you to answer those, and then let's see if we've got any phone callers. And we're going to put these in the record for even people to come back to, because some of them came in the chat line pretty early. One of them was from a gal named Jackie. I have a white-coated tongue. I've been suffering for 6 days with influenza. What should I do to correct this?
Well, I don't know if I've blogged about influenza, but I've certainly written a whole detail of how to treat it in my Future Health Now encyclopedia. You could email into customer service support at rnareset.com, and they will very happily cut and paste the whole influenza text to you.
Okay, wonderful. That sounds excellent. Yep, and I'm going to put that on the chat line, support at rnareset.com, and then in the subject line just put influenza protocol, and we'll send it to you. Carolyn, what about a Brita filter? I use a fridge filter and then a Brita filter. I buy spring water. Do I have to worry about fluoride in spring water?
Well, you have to check the label. I don't think spring water is necessarily fluoridated, but we get crazy companies that will just put tap water in a bottle and not label it. And Brita does something, but I do agree about the fluoride, and I know that if you're on your Remag, you are bouncing some of that fluoride out of there, but it is best not to ingest it. And at the same time, I tell people not to think that we have to be that extreme and avoid everything. The sky may fall, but it's not going to fall on us, and our bodies can adapt, adopt, and survive. That's our policy. So all those things I will say to you.
Very good. Now, we do have a recommendation for a water filter that Dr. Dean has enjoyed referring before, but I'm trying to get their website to come up, and it's not working, so I don't know. We will probably, I don't know if his, let's see, maybe here we go. It might be working. So, okay, very good. All right, it's working. They're in Georgia, and they do have the, they go into great specifics about what they'll take out, including lead, chromium, mercury, what they have in them, so on and so forth. And these do take out the fluoride. So if you want that recommendation, then you have to email support at rnareset.com and put in water filter in the subject line, and we'll send you that information. It's too much to share phone numbers and all the rest of that business. Okay. Then let's see. The other thing was, here's a question from Sue. I've been on a paleo diet for 2 years. Shortly into it, I started losing my hair. Could the paleo diet have had an effect on my thyroid? I'm told by my functional medicine doctor that I have secondary hypothyroidism. Any suggestions?
Well, I mean, it's hard to say. I don't know what foods you're eating on paleo. Losing hair, to me, sounds like thyroid, and that's where right away we put people on the Remite or recommend the Remite for the 9 minerals that support the thyroid. I don't know why paleo would make someone hypothyroid. I'm not... nothing's coming to me about that, but I think, as Dr. Hotze mentioned, the fluoride can block it. Yeast toxins can block the thyroid. Mercury can block the thyroid. A lot can be going on. If a person does a diet and they do go through weight loss, then all those toxins from the fat cells can permeate the body. That's why we recommend Realign all the time, because that's our natural detox. So if you're dieting, you don't feel yucky because your body's detoxing. So Remite, Realign, look at my thyroid book. I have all the different triggers that can lead someone down the hypothyroid path. So
very good. Excellent. Here's a question from Linda. Can an 8-year-old, oh my goodness, an 8-year-old with Hashimoto's, oh my goodness, how does that happen, take Remag with their meds?
Oh, absolutely. I mean, the only thing the FDA won't let us talk about is what to give children under 4 years of age. And even then, if you look up the RDA for under 4, you have to make your own decision. But your child is 8. They take actually very near the adult dose. I was looking up the RDA and the DRI and all those different aspects of magnesium. And these children need a lot of magnesium in their development. And it's Remag is like taking food. It doesn't have any yucky additives in it. It's pretty very clean product. So please take it.
Very good. Very good.
And what about Hashimoto's? What about Remite? Because of the 9 minerals that support the thyroid. So please look at the thyroid book. You can find it free at drcarolyndeanlive.com.
Right, absolutely. That's the next thing I was going to ask is about the Remite for the, Okay, now we have a question from Mary. She says, I have a 17-year-old who was depressed and found was low on iron. Since iron supplementation, doing well on the depression, but anxiety is still a problem. Her naturopath says magnesium is fine. Her hair analysis says low lithium, phosphorus, and sodium. Her endocrine doctor says all are fine. What should we test next?
Well, it's not a matter of testing. It's a matter of just, in my opinion, kind of the common sense of if iron is low, the other minerals are low. Blood tests and hair tests do not give you a perfect picture of your minerals. You look at the clinical symptoms. And if the clinical symptoms match, then do the minerals. Even if everybody needs extra Remag and everybody needs Remite. That's what I'd say. I really think testing is overvaluated. We know that 80% of the population is magnesium deficient, so we should all be taking some.
And on the lithium, Carolyn, do we have anything about that? I mean, we have said to people before we don't have any conflict with that.
Well, there is low-dose lithium. The naturopath should know about that. I don't want to be prescribing for a 17-year-old. I think the mom can look up low-dose lithium and check into that and talk with the naturopath about doing a trial of low-dose lithium.
Very good, because sodium is in the Remite, and so that's covered too. So you've got most of everything that you need with the Remag and the Remite.
And also, that's where I would be talking about putting the sea salt in the drinking water. I mentioned.
Oh yeah, that's great.
That our filtered water has no minerals, and so the sea salt will be very helpful. And there's your sodium there. And was the testing, Ginny, in the 17-year-old? Was that a hair analysis or blood testing? Did they say?
Hair analysis.
Yeah. See, a hair analysis is 3 months old by the time you get the results. And I really I studied everything. I studied absolutely everything in my universe. And I could never pin down hair analysis. And the people who tried to give me a hair analysis reading after having my hair analysis, it was all intuition, and half the time it wasn't even accurate. I really don't. I think you can make vast generalizations, and that ends up being, well, why bother with the hair analysis? Just give the low potency, 100% absorbed minerals in Remag and Remite, and let your body sort it out. We don't have enough foolproof, 100% accurate, 100% of the time information on hair analysis that we can follow it.
Very good. Excellent. Yep. Excellent. Okay, wonderful. All right, let's see where else we are at with our questions. Okay, a couple questions that came through let's see, that we didn't get to. We talked about the, do either of you know about the heavy effect of, do either of you know of the effect of a heavy metal load on the thyroid? I don't want to do an expensive chelation therapy. I'm trying to follow the medical medium's nutritional protocol for removing heavy metals, but it takes a long time. Can Remag help me?
Well, yes, there's this medical medium out there that everybody seems to be following. It's kind of interesting, but that I mentioned it already. The Realign is your heavy metal detoxifier, and it is not an intravenous. It's not a big chelator. It doesn't take out all your other minerals, which is what happens in chelation, unfortunately. Mercury can block the thyroid. Fluoride can block the thyroid. A lot of things can. So it's a matter of good diet, taking the Realign. The Remag is going to help. Magnesium is a great detoxifier. The Remite will help as well. It's the combination of things that I've settled on that really seems to help people. I think the high-dose ascorbic acid people, they had so many good benefits because it forces certain things in the body. But then, and the studies show, yeah, this is wonderful, but I think it can throw things out of balance. That's why I like to keep a low potency, high absorbed nutrients and then let the body work it out. I wonder, is there a reason why humans don't have vitamin C production? A lot of people said, it's because humans start to eat so many fruits. Well, look at all the animals that eat all those fruits and get all that vitamin C. They didn't stop the production of their vitamin C. So we still don't know the answer to that one.
They say that the Eskimos produce their own vitamin C because adaptability-wise, they had to produce it for some particular reason in order to do something. I can't remember. I read this article a long time ago, but they say that the Eskimos actually adapted, and they do. So maybe it's just one of those things where maybe the body's kind of, lazy and doesn't want to do it unless it has to. I don't know.
Interesting. Yeah, I'll have to look into that. When there's an exception to the rule, you really do have to look at it. And like Ion always said, if something happens without fail or exception, then you accept it. But if there's an exception to the rule and some people make their own vitamin C, well, let's go ahead and make ours. I'm all
right. Exactly. That's right. Let's get busy. Get busy, body. Make some vitamins.
Yeah.
That's right.
We know you're not lazy. I'm sorry Ginny said that. Ginny didn't mean it.
Ginny didn't mean it. Well, we make our own stem cells and everything. So, we can figure out how to direct those little guys, too.
Yes.
Yeah. Yes. We've got a lot of power in this body, that's for darn sure, don't we?
Yes. Oh, look, we see it every day. Customer service, the emails we get, the radio show, the testimonials. I have so many. This one of our 5-year customers who says she just realized, I burned myself. I totally 350-degree touching a pan or her wood stove or whatever. She burns herself. She puts a little ice on it, and she forgets about it. She says her skin and her body is so healthy now that she doesn't even get wounded. This is what we want to achieve in our life, is that we, heaven forbid, the contrast happens, but then our body just deals with it. That's what we want.
Yes, and another thing that you can do in addition to taking the products is you just kiss yourself a lot. That's what I do.
Oh,
I kiss my hands. I kiss myself a lot and tell myself how wonderful I am. And it's amazing how quickly the body responds. It's like, yes, ma'am, I'll get right on that.
Right.
Absolutely.
Right. Rather than people who every time they think they make a little mistake, they scowl and, oh, damn, you don't do that. Your body will kind of feel that. And so your body has to know that you're with it 100%.
That's right. That's right. Okay, here's some other questions. We didn't get Dr. Hotze, and then we'll go to some phone calls. 602-666-6027 is the number. We had some people in the first part of the hour who definitely got probably tired of it. You can call back in now. We are going to take your calls. 602-666-6027 and just hit star 5, and we will put you on the radio with Dr. Dean after this question, which is, besides medications, what can I do for my thyroid? And I was also told that my blood sugar is high and I need to watch what I eat. I do take a water pill. So will the Remag and Remite help since it's so salty? I was told to watch my sodium level because I do have heart problems. I have a defibrillator.
Wow. I mean, that's a lot, but the thing that jumps out at me is there's no salt. Where's the salt? There's no real sodium, a few milligrams of sodium and Remite, so that's not a problem. This sounds like a person who really hasn't done much of reading of our information yet, because what you'll find is you need the unrefined sea salt to help get your minerals. The Remag will help support your heart. The thyroid, we work with the Remite to help support the thyroid. So it's probably be a good idea to go to the website that has my free ebooks, drcarolyndeanlive.com, and just pick out the ones that seem of interest to you. There were so many problems that the person mentioned. I'm not going to say, well, Remag will fix it all. I don't know where you're at with your health or with your diet or with your dietary supplements. You're also on medication. So just start reading, get the Remag book, even listening to this show, listen to some of our archives as well, which are at Dr. Carolyn Dean Live, and just educate yourself. Your body wants to feel better. And what we say is if you give it the right building blocks, then you're giving it the best opportunity to feel better.
Excellent, excellent. Okay, and let's go to our caller. 602-666-6027 is the number to call this evening if you'd like to talk with Dr. Dean. And just hit star 5 on the keypad and let me know that you're here, and I will put you on the phone. Although nobody's raising their hands right this second, Carolyn, so I'm going to keep asking questions. Okay. Hi, Dr. Dean and Ginny. Great show tonight. I've been following a group closely that has a rather drastic protocol, but if the testimonies are true, it seems amazing. Arteries growing new routes to the heart. Okay. Here's what she's saying it is. It's 2 cups of water and 2 cups of cabbage, a tablespoon of pink sea salt fermented for 3 days. You drink a gallon of this per day with lots of fresh water. This caught my eye because you have recommended adding a bit of pink salt to our water for minerals. My question is, how would this concoction work? How can this much salt be helpful? I'm very curious. It just seems like you'd be in the bathroom all day. I love your products because they fit nicely into my lifestyle and they make such a big difference. Thank you for being so joyfully available to all of us. Okay, so here's the protocol. 2 cups of water, 2 cups of cabbage. Yeah. 2 cups of water and 2 cups of cabbage with a tablespoon of pink sea salt, and you ferment it for 3 days and drink a gallon of this. Per day.
Per day. How many days?
She didn't say. Jillian, type me back and tell me how many days.
Does this go on forever? Well, fermented vegetables, we know that they have probiotics. Cabbage, it has the vitamin U that supposedly treats ulcers, and cabbage has a lot of nutrients in it, so it's going to give you some nutrients, but it's kind of extreme. I've tried to ferment vegetables. It's a big deal. I don't know if it's sustainable. I'd rather just drink my minerals.
Right, yeah.
Yeah, the sustainability of these things. It's like there's something extreme about so much of what's going on today that I can undo a lifetime of horribleness with such and such. But we do have to sustain these shifts, and we've tried to make it very easy by just swallowing a couple pills and your minerals.
Yeah, very good. Excellent. Okay. Let's see what else we have here on the chat line.
And the other thing, let me just say about the way it works with testimonials. If you get a population of people who they're a mess, and they take something healthy, it'll turn them around. They will feel awesome. And it's easy to get testimonials, and I'm saying that knowing that we get a ton of wonderful testimonials, but we can sustain it. We have testimonials for people who've been doing this for 5 years, and they continue to feel better. So for that too, healthy, very sick people on a lot of meds will feel better. If they start to just shift their diet, they'll start to feel better. But are they? Anyway, I'll just leave it at that.
Yeah, I agree. I agree. Okay, very good. Excellent. Okay, wonderful. All right, let's see where we at, everybody. Let's see if we've got phone callers here. There we go. Very good. All right, let's go to area code 410, the great state of Maryland. You're on the line with Dr. Carolyn Dean. If you could give us your name and then state your question or comment.
Yeah. Hello, my name is Richard. I'm 70 years old, and I have MS, progressive MS. I was taking Natural Calm magnesium for spasms in my legs, and someone told me that if you take magnesium without calcium, it takes the calcium out of your bones, and you can end up with osteopenia or something. And I was wondering if that was true.
Let's answer that first, Richard. Magnesium does not work that way. It will dissolve calcium in soft tissues, in the arteries, in your pineal gland, in areas where it's not supposed to be. What magnesium does with bones is it helps pull calcium into the bones. It's necessary. There are a number of studies now coming out saying, oh my gosh, it's not calcium that really helps bone health, it's magnesium. So it's not like they're saying, but it's like a half truth, Richard, where magnesium can dissolve calcium, but if it's in the wrong place. Now, what I say about calcium is that most people can get enough calcium from their diet, and the best amount to take every day is about 600 milligrams, not the 1,200 or more that we talk about in the American RDA. The United Kingdom and the World Health Organization say 500 to 700 milligrams. So I say 600. If you're eating dairy, kefir, fermented dairy, yogurt, you can often get enough calcium. But if you're not eating any dairy, then you have to look at things like bone broth, your deep green leafy vegetables, nuts and seeds. And if you're not even getting that, then I do have a calcium liquid just on the side, just in case people don't get enough. So, one of our booklets is called Remind excuse me, Remite/Recalcia. So you can read more about that.
Okay. I have started taking your Remag and the Remite, and I don't know if there's anything else that might be helpful for MS.
Right. Well, we're not allowed to talk specifically about treating diseases, but what we do know from the minerals is that they are very important to support the structure and function of the whole body. The RNA drops can be very helpful. We've had a lot of people with chronic diseases, autoimmune diseases, progressive diseases who've taken the RNA drops, and they're very helpful. That's a germinated barley seed, and the liquid from these thousands of pounds of barley seeds we've been growing. What are we in our 140th generation, Ginny?
Yes, ma'am.
Yeah, so we've been growing it for 140 generations, which means every month or so we grow a new batch of these barley seeds, and we take an amount of the previous batch and put it in the current batch. So we have a harmonic, almost a homeopathic harmonic of this liquid RNA drops. So there's something very powerful about it. And we have the Restructure. Restructure is our whey protein powder with a number of ingredients that make it more of a real meal replacement. And in it we have the RNA drops in powder form. If people don't take the drops, they can still get it. And then the thing about MS, too, there's the gut health. So I would work with the Prescript Assist probiotic that we recommend and really look at the yeast reset protocol, because often with the medications for MS, you can get into yeast overgrowth and then get this kind of loop where you're forming more toxins that irritate the nervous system from the yeast toxins. Have you looked into yeast overgrowth, Richard?
No, but I am taking a probiotic, Garden of Life. It's supposed to be a natural.
Right. Yeah, Garden of Life. That I think they used to be soil-based, but I don't know. I think the FDA kind of came down on them. So look at it and compare it to the ingredients of Prescript Assist. That's the one. We don't make it, but we do sell it because I think it's the best. So look at the ingredients, because I think Garden of Life went from being good soil-based to now they're mainly Lactobacillus and Bifidus, which are weak probiotics.
Okay, and this one said was prescriptive?
Yeah, Prescript Assist, and it's on the RNA Reset website. And the yeast book I've written, it's a free book about yeast, Reset the Yeast Connection. It's at drcarolyndeanlive.com. So you can read about that, read through some of my information, and then you can get in touch with customer service, and they or I will answer your questions. Okay?
Does your Realign, does that have RNA drops in it?
Oh, sorry, I didn't mention. No, Realign, that's the methylated B vitamins, and the Bs are very important for the nervous system, actually. And it's also got taurine, which supports the heart, and methionine, which is the precursor to glutathione, which is the body's strongest antioxidant. So, yeah, that would be the other one to take.
Okay, just one more thing. They tell me you don't do consults anymore. Is there any way I could get in touch with you to do a consult?
I don't do them, but I'm very available. What you do is go through customer service, and customer service is very well trained to answer a lot of questions. But if they have a question, they'll just put you over to me. So you will get to me.
Okay. Well, thank you very much.
You're welcome, Richard, and thank you for calling. Bye-bye.
Bye.
Okay, excellent. Live with Dr. Carolyn Dean here on achieveradio.com. About 12 minutes to the top of the hour. 602-666-6027 is the phone number. If you did have a question for Dr. Dean tonight and you wanted to talk to her, we'd be happy to put you on the phone. Otherwise, we're just clicky-clacking along with our very good questions that are coming through. Couple of questions. If I have Hashimoto's, can I use the Remite? It has a lot of iodine in it. Shouldn't I be careful of iodine? That's a great question.
Well, that's information that people have heard about over the years. The iodine in Remite is only very low RDA, but it's enough to support the thyroid, along with we have selenium in the Remite, which helps metabolize what the iodine does. The problem with iodine came about because of a lot of people getting involved with high-dose iodine intake. They would build up the metabolite that iodine would kind of produce in metabolism, and then the body wouldn't know what to do with this downstream metabolite, and you need selenium to metabolize that metabolite, and then you need the other 7 minerals that the thyroid requires to finally make your hormones. So it's just a matter of balance and the amounts as well. So personally and scientifically and medically, the amount of iodine in the Remite is safe if you're taking it along with the selenium in Remite.
Excellent. Yes, that's a very common question, so I'm glad, and I know you've answered it before, but it's always good, especially a lot of the topic tonight being hormone thyroid related. It's always good to have that answer on tap. Here's a comment from Barbara Carolyn. She says, I recently started to use the Remag lotion on my low back. I was having so much low back pain that I almost made a chiropractic appointment. After a few days using the Remag lotion, my back pain is gone. Thank you for saving me $50 for chiropractic treatment, which sometimes helps and sometimes doesn't. The lotion is very nice and smooth, and a little seems to go a long way. Thank you again. I'm very pleased.
Oh, that's very good. Yes, I have a whole list of Remag testimonials, but we'll answer all the chat questions first.
Okay. Jillian typed back, Carolyn. She's the one with the cabbage cure, 2 cups water, 2 cups cabbage. She says, you take it for months until you feel better. Most people have done this for 6 months and then taper off to 2 cups a day. I just had to put that in. Then she said, thank you for your answer. So I thought that was cute. Can you imagine? 2 months, I couldn't do it. Months and months of that. No. Joyce says, I'm curious if Dr. Dean has an opinion on higher dose iodine for chronic viral titters, EBBHHBETC.
Titers.
Chronic? Titers. Okay.
Titers. Yeah. No, I'm not. That would be under doctor supervision. I would not say anything about high-dose iodine for chronic virus. I mean, when I did the AIDS and chronic fatigue work in New York in the 90s, everybody had yeast, everybody had all the viruses, they had all the parasites, and their immune systems were shot. And that's where one of the layers of my protocol developed, where you have to support your immune system. You can't keep killing these things. Everything that comes up, there's something about and it's an older book, the calcium bomb. They talk about calcification and nanobacteria, and they say, shouldn't we just use tetracycline and chelation? It's like, no. Where did this come from? And nanobacteria, seriously, what people don't know is the life cycle of organisms. If you look at what's his name, Bob? Gaston Naissance. guest on Naissance. Look him up, Naessens. He developed a protocol for cancer. But his big work was looking at the life cycle of organisms, and he would look at a bacteria and watch it transform into a yeast and then a virus and just go around this whole cycle. Lida Mattman, Lidamatteman, I think it's M-A-N, Mattman. She wrote a book called Stealth Pathogens, and they're cell wall deficient forms of organisms that you can't even culture most of these things. They just kind of stealthily go in and affect a body or a person. I think it's some of this crazy biofilms that people talk about. And again, biofilms, they have magnesium. Maybe we shouldn't even take magnesium. Well, they have a ton more calcium, and magnesium is actually going to help you dissolve. So we know nothing about organisms. When you study organisms and understand about stealth pathogens and the whole 16-stage reproduction cycle that Naissance discovered, showing that these organisms can transform right before your eyes. He was looking at them under these incredible microscopes he developed. You know you cannot kill these things. You know you have to develop your immune system. You have to support that. Yeast is the big one. Yeast will set the stage for all these organisms, so that's why I focus on yeast. So that's my rant for today, and I don't know what brought that on. What brought that on?
Well, no, what brought that on was the idea that you just kill. And we've talked about that before. You don't kill. You feed. And you feed the immune system, as you say, with responsible, you feed it at a cellular level. And that's one of the things that Dr. Bruce Lipton discovered, too, that you can take a cell, you can isolate it, you can put it in a petri dish, and they're so committed to life, they will reinvent themselves, like you said, right before their eyes, and they will turn a toxin into a food, which is what Ion would say. What you can deal with anything. The body will find a way because its impulse is for life. So yes, absolutely. This idea, kill. We just want to live, and feed the body with the proper nutrients, and it will deal with itself. It will deal with everything. It's very capable. Oh, yeah. Absolutely. Okay, now let's see where we're at. So we got that, and let's see. Did that? Oh, chronic viral teeters. That's what we were talking about. Okay, excellent.
Yeah, got it.
Okay, so I think we're caught up. Excellent. Do you have something you want to share?
Well, let's see. A nutritional therapy practitioner said she ordered Remag for a client who was dealing with tachycardia. I'm happy to report that within 2 days of Remag therapy, her rapid heart rate returned to normal. She was sleeping through the night. She had been taking magnesium therapy that was causing bowel tolerance. She was tired of having loose stools. So I discovered Dr. Dean's book and offered this to her as an option. The loose bowels have stopped, and she's a very happy client. Her anxiety is also improving. We're thrilled with the results. So we're not treating a disease there. We're just supplementing a person who has low levels of magnesium. Melody Rose in customer service talked to a customer whose son had Tourette's syndrome, and she reported that when they slather Remag lotion on his back, his tics slow down or stop. She also said that a bee sting effect that drives him crazy has stopped with the Remag lotion, which is so awesome. Someone is saying, I want to affirm that Remag has profoundly changed my life. I suffer from heart palpitations, have for years before finally went on a drug atenolol, which I took for 15 years, until I read something from Dr. McCullough, who said, you're not suffering from a drug deficiency. And she said a light bulb went on. I realized that after feeling like crap with zero energy for all that time on a beta blocker and piling on 40 more pounds, it was time to go a different direction. I stumbled upon you and began taking Remag. The time it took my heart to normalize was minutes of taking the first dose. I'm not kidding. If you've ever experienced irregular heartbeats, you know how terrifying it is and how rotten it makes you feel. And she said she's had magnesium deficiency now her whole life, that she realizes she had toxemia with her first pregnancy, and that's a magnesium deficiency, the eclampsia she's talking about. And, it's these types of statements that we get from people. Somebody who's treated within minutes, they do not have a heart disease. They have a magnesium deficiency, and that's my FDA defense. Another person, I've been using Remag for many years. I do not have AFib, but did have horrible and painful muscle cramps, mainly legs and thighs. Happy to report I'm not taking anything except the Remite along with the Remag, and I've been free of muscle cramps for over a year.
Oh, Carolyn, our radio show timer's off because we ran over, so we're done.
We are done. Okay. Awesome show. Thank you. Thank you, Ginny. Thank you, Dr. Hotze. Thank you, callers and chatters. Great show.
Yes,
thanks, Ginny.
Yeah, Shelley typed in about Dr. Dean and Dr. Jason Fung. Shelley, tune in next week. We're going to be talking about it. Thanks, everybody. Have a wonderful week, you guys.
Thanks a lot, Ginny. Thank you, Carolyn.
Thank you, Bob. My inspiration.
Bye, Bob.
Yes.
You're listening to AR, thechiefradio.com. What talk radio should be, all the time.
Got a new tech device? Be sure to recycle your old one. The Consumer Electronics Association is making it easy to recycle your old TVs, tablets, and smartphones. Go to greenergadgets.org, type in your zip code, and you'll find the recycling center closest to your home. That's greenergadgets.org.